Before I became a dialysis nurse, I honestly had no idea what dialysis nursing really was going to be like. I didn't realize how much there was to learn, how involved we are actually during treatments, or how different dialysis nursing can look depending on where you work. Now that I've kind of worked in both acute dialysis in the hospital and incident dialysis, which is outpatient, there are definitely some things I wish somebody would have told me before I started. So if you're a nurse, a new grad, or even a nursing student considering dialysis, I'm going to tell you what dialysis actually do, what the schedule is really like, the training, and the things I love and don't love about it, and some of the biggest misconceptions I hear about dialysis nursing. And at the end, I'll tell you whether knowing what I know now, would I actually choose to do dialysis. So let's go ahead and get into the video.
And it goes a little something like...
Before I even thought about doing dialysis, I started my first year as a new grad on a rehab floor inside of a hospital. So we were like a facility, our own facility within the hospital. And I just wasn't getting any fulfillment out of there. Like I would leave work sore. It was just like, it's rewarding to see like your patients, you know, doing better and getting their modalities back. Because we had 3 different floors. We had the spinal cord, which I worked on. And then we had our not neuro, it was like brain injuries and stroke areas and stuff like that. And I worked on the spinal cord floor, which was the most intense floor because you have a lot of car accident victims, fall victims, like hip fractures, gunshot victims, and stuff like that. And them just trying to like learn how to care for themselves. A lot of straight casts, quarter lifts. It's a lot on your body. A lot of like continuity of care and working with a team. You got PT, OT, you got speech therapy that you're working with and coordinating with. Everybody you are coordinating with. And it was just a lot. I knew I wasn't gonna stay there long. And while I was there, I was actually trying to pursue labor and delivery, find jobs there. It wasn't working out. At least in Charleston, the job market kind of sucks. There aren't that many options. And it wasn't what I was looking for based on my lifestyle. A lot of it was like night shifts. And closest thing that I found for a new grad, people that would accept a new grad, was in Georgia. Like, be so for real. In hindsight, I'm glad that didn't work out. So that didn't work out. I continued my search to look for different jobs, and I stumbled across hemodialysis. I was like, I don't know. I hear like it's kind of boring. Like all the ICU nurses were telling me, don't do hemodialysis. All of my military people, because I worked in a medical unit, don't do dialysis. Like you're gonna be so bored. You're gonna lose your nursing skills. They don't really do anything. They just sit at a monitor. And that kind of ties into like misconceptions. And I'll get into that later. So I was kind of hesitant, and I did my own research, and I fell in love with the technical aspect of dialysis, like the machines, like how cool it was that we can have an artificial kidney on the outside of the body, and yeah, a little bit of it. That's how I kind of fell in love with dialysis, and then the idea of getting to know my patients and seeing them regularly and being able to help them and communicate with them. And besides that, I didn't really know too much about dialysis outside of learning it in nursing school, because when you're in Med-Surg, you touch on like hemodialysis, peritoneal dialysis, all different types of dialysis briefly, but you don't go into like a lot of detail. So I kind of knew what dialysis was, just not in depth of like what the day-to-day was going to look like for a nurse, because we didn't shadow on dialysis units. We were on Med-Surg floors. Like I know what's going down on the Med-Surg floor, and I know that's not where I want to be. So, and we did like peds and all the stuff, but dialysis, like specialties, we didn't touch on any other specialties outside of labor and delivery. When I got a dialysis job, I expected what everybody told me. Oh, you're just gonna sit around, you're gonna watch your patients. I'm like, oh, that's an easy job, that's easy money, I could definitely do that. Now, what I realized what was completely different once I started is you're not just sitting down. You're on your feet a lot, especially like in the center. You're on your feet a lot of the time, especially with South Carolina states. Like your techs can't do a lot of the things with the catheters, so if you have a lot of catheters, you're running around. I would do a completely separate video on in-center versus hospital if you guys want to see that, and just leave a comment or like this video and I'll make a comparison side by side of both of them, and you can kind of see what best fits your lifestyle. Now, I did not know how to do dialysis before starting. You do not need any experience at some facilities. Most of them, you don't need any experience to do dialysis. They will train you on everything, especially me being a new guy going from a rehab facility where I wasn't using my nursing skills and going to another facility. I definitely felt new. So they teach you like how to train the machines. You'll get, my case was a little bit different because we did like a mass orientation because we were going to get trained and then go on our own to a different facility that hasn't opened yet, so it was a little bit different. But we did like videos. We learned like in depth of like what the machines do, like cleaning the blood. The blood will get pulled from the patient, go into the machine, go through the dialyzer, mixed with the dialysate, and I'll go more into detail about all that stuff in another video. Go into the dialysate in simple terms, which is like a bath combination to help pull all the toxins out of the blood. Then once it's clean, and then it will go back to the patient through the blue tube. There are two colors that you need patient to dialysis, and that's red and blue. You have to pass a test. Now, hospital, I did have to pass a test, and in center, I did have to pass a test. It didn't matter if I came with prior experience, you still have to pass their test for the facility. And I had to get tele certified. You do not need ACLS, you just need basic CPR for dialysis and nursing. I got training on the machines, what to look for in patients if they're going to bottom out, what to monitor for to see like trends to catch it before it even happens, and common hemodialysis reactions or dialyzer reactions. Now, to be honest, it took me about a year, like not even a year, I would say. Like I wasn't in the hospital for that long before I moved to in center. I think I was there for exactly a year. So my second year being a nurse. I think the training was about 6 weeks in total. Like you were on orientation, and then that was it. You were on your own. And then it took me about, I'll say about 4 months to feel completely comfortable with not having to ask questions, getting my own flow of things, and not feeling like, oh, I'm behind, I need to catch up. Same thing with in-center, because it's completely different. Like, I don't care if you have hospital experience, in-center is a completely different ballgame because you have two completely different goals. You're dealing with completely different things. So I learned more about dialysis as an in-center nurse. Like, if you want education on dialysis, I would definitely recommend in-center because you go more into detail about what dialysis is. As for the machines, it was very, very intimidating, and it looks so intimidating doing dialysis machines because of all the strings. It looks complicated, but once you know it, it's like riding a bike. Like, it's not that hard, and it's very cool. And having to learn two different machines, because hospital has the very newest machines, and the in-center I work at has like older machines. So I know two different machines, and I still work at my other job PRN as needed. So having to go back and forth and like flip is kind of insane. Like, I have to really lock in and remember what I'm doing, because completely different night and day. It's like speaking two different Spanishes. Like, I'm speaking Spaniard Spanish in center, and then like Dominican in the hospital. Like, it's insane. Like, I'm trying not to go into too much detail because I'm trying to make a separate video about it. Dialysis is a very, very specialized field, and so much that goes into it, and there's so many things you could do within dialysis. As a nurse, you can do hemodialysis. I think the most common question I get asked is like, what a dialysis nurse does. Like, do the machines basically do everything for you? Machines do their work. So you're taking care of two things, I like to say. You're taking care of the machine, and you're taking care of the patient, because there's a lot of troubleshooting that goes into the machines. You do have to program, and the patients will have orders, and you have to put in that patient's order in the machine. So there's a lot of troubleshooting, and then you need to figure out what's going on with the machine. And if your patient is like feeling bad or anything, you need to troubleshoot them. Like, so you're taking care of two different things at the same time, and you're not just sitting around like this looking at a screen monitoring. Dialysis is not that boring of a job. Like, you do have your downtimes, but when you're moving, and you have your rush hours during what we call shift change. As the nurse, you're responsible before the treatment. You are responsible for everything. You are the nurse. You are the licensed person on the floor. You cannot blame everything on your techs. Yes, your techs have their responsibilities, but it's your job to go behind them and double check that everything is good and okay. You need to verify that medications are good, heparin, their prescribed medications. I usually get like vitamin D, Mircera, iron, and some other medications, patient specific. But the most common one is the vitamin D, iron, and Mircera. A lot of patients do get those, and then whatever added medications that they do need. But those are the top. Like, if they're going to get heparin to prevent blood clots through the machine, your job is to make sure all that stuff is done, doing the water checks and make sure there are no breakthroughs like bleach through the RO system, making sure that they're on the right dialysate bath, that's your acid and your base, because that is potassium and calcium. And if you give the patient, say their potassium is already high, and you give them a higher dose of potassium, they can have a heart attack. They can have a stroke. Like, potassium messes up with the heart. If you learn that Med-Surg, you know that. So this is very serious to pay attention to what type of bath they are on, which is why we draw weekly labs. During the treatment, you will, as a nurse and the tech, you will be monitoring the patient's blood pressures, their pulses, and that's every 30 minutes you need to take their blood pressures. If you know that they are prone to their blood pressure dropping during treatment, I will set that to every 15 minutes, every 10 to 15 minutes, and taking their blood pressure. Pay attention to your patients if they're yawning a lot. That means their blood pressure can be dropping, like yawning very loud. Or if they suddenly get hot, like all of a sudden, like dialysis, in like I don't care, it's always cold whether you're in the hospital or in center. Dialysis is always cold for some reason, and if they suddenly get hot, go ahead and turn that you're afraid off. Turn it off. Stop the pull. Stop pulling fluid from the patient, because their blood pressure 9 times out of 10 is dropping. Like, I want to say 10 out of 10, their blood pressure is dropping, even if it doesn't show yet. It is a telltale sign that their blood pressure is dropping. Just knowing your patient knows their body better than they do. So not just monitoring, but listening to your patient. Like, I always ask them, how much fluid can you pull off today? Because a lot of them will cramp, or the blood pressures will drop, or they feel really sluggish after dialysis, and it takes them a long time to recover. But back to the blood pressures, if a patient's blood pressure drops, in the hospital, we have something called albumin that we can give them, because we don't like to give fluid in the hospital because they are already chronically ill, and obviously in the hospital for a reason. In center, we do not have that option. The only thing that we can give them is fluid, a saline. That's it. A saline bolus. That's all we could do. Same thing for cramping. When in doubt, saline it out. I don't personally like to give saline, but it doesn't matter. They come to treatment 3 times a week, so know the next treatment we're going to try to get the rest of the fluid off of them. We're going to tell them to watch their fluid intake until next treatment. They should be watching their fluid intake regardless, but some patients are hard-headed. You come to find out. As a nurse, things that you assess for with a patient, you need to do a pre-assessment and a post-assessment. You're going to see if they're how much edema they have. If they have any, you're gonna listen to the lung sounds to see if they have any fluid on their lungs, and that's how you know that you need to try to challenge them, even if they don't want to be challenged because of the fluid. And you need to listen obviously to their heart. Those are really the 3 main things. So heart, lungs, and checking for edema are the main things that we look for. We also do foot checks, but that's like a monthly thing. There's a lot of things that you need to do. Asking if your patient is on heparin, assess if they had any falls recently, because you do not want to give them heparin and not know if they had internal bleeding, especially the older people. As for patient education, as a nurse, you educate your patients to watch your fluids, check their feet daily if they're diabetic, making sure they are eating the right foods. We do have a nutritionalist for that, but make sure they're avoiding things that are high in potassium, high in calcium, because obviously their kidneys aren't filtering those things out, and making sure that they have a healthy overall diet, because the number one cause of being on hemodialysis or being a dialysis patient is hypertension, uncontrolled hypertension, and uncontrolled diabetes. But the most common one I see is high blood pressure, especially in the south. Like, some of my patients have 200 over 100 blood pressures standard. While my patients are dialyzing, I am catching up on my charting. I am getting ready for my second shift patients, getting their medicines ready, making sure everything is, I'm going and doing my rounding to make sure that I'm checking all the dialysate baths, making sure all the orders are in the computer correctly. Once I'm done with all my charting and all that, usually takes me like, I try to chart as I go, so that way I'm not behind. And after like the rush and the going through, making sure everybody's on the right dialyzer, right bath, the right orders. And like, the orders include like the bath solution, and how much they're supposed to run on dialysis treatment. Usually anywhere from 3 to 4.5 hours. The longest I've seen is 4 hours and 45 minutes for a patient running. Things that I learned during dialysis is dialysis machines, what a fistula is, what a graft is, catheters, not like urinal catheters, like invasive catheter, fluid removal, what dry/target weight is, your blood pressures, different labs that we draw on a consistent week-to-week basis, and common dialysis medications, complications during the treatments, and The hardest part for me to learn was, I guess, the machines. Like, I would say the hardest, but the one that overwhelmed me the most was the machines. Like, I felt overwhelmed before I even started. But once you get into it, it's like second nature. Like, you can do it in your sleep. Like I said, riding a bike. As for the schedule, what I really wish I knew early on in dialysis was how early you start. Like, you can start anywhere from, the techs usually have to be there an hour before the nurses. So if the nurse, you can start anywhere from 4 a.m. to 6 a.m. Some facilities I've seen. Some facilities I know start at, they have to be there by 3 to be open by 4 or 5. 4 o'clock, I think. Yeah, 4, which is insane. My clinic, we don't have to be open until 5:30. Our techs have to be there at 4, 4:30-ish. The nurses, 5. And in the hospital, you have to be there at 6 a.m. to start at 7. In center, your shifts can run from anywhere from 10 to 13 hours. In the hospital, you do, if you're full-time, you do 12-hour shifts. If you're part-time, you do, I believe, 8 to 10-hour shifts. If you're PRN, you just do the hours that you can. Part-time in center or whatever, it doesn't matter if you're PRN, part-time, full-time, you still work the whole shift, like the hours. Monday, Wednesday, Fridays are long days, so we don't close until like 7:30 whenever our last patient stops. And then Tuesday, Thursday, Saturdays are our short days. And we usually end the day around 4 o'clock and walk out the door by 4:30, so it's not bad. Get there at 5 o'clock. So those are our short days. As for our holidays, we would do like a mass dilation of all the patients on the eve of that holiday, on major holidays, and then we will have the holiday off and back the next day, unless you request it off or whatever. Same thing in center, and everybody will have like a holiday rotation of when you're supposed to work, whether it be Christmas, Thanksgiving, and I think those are like the two major holidays, Thanksgiving and Christmas. We're closed on Sundays. I've seen that like baseline for dialysis. Closed on Sundays, but we are open on Saturdays and we do rotating Saturdays. Dialysis nurses do not work nights. I know some hospitals, they do have like a nighttime dialysis to eliminate the on-call shifts, and I will go more into detail about that in the video that I had linked earlier. In the clinic, every patient has chair times. So they're supposed to be there 15 minutes, 15, 20 minutes early before they're supposed to be there for their chair time. And they're get off at their off time. So say my patient has a chair time of 5:30 a.m. They should be there at 5:15. That way we can work them up. Work them up means getting their vital signs, doing the nurse gets to do their assessment and all the things, and get them connected to the machine so they get stuck, their catheters can get clean, all the things, and by that time get on the machine on the time and get off at, let's say get off at 8:30. They run 3 hours. So there's really no getting behind at the clinic unless there are facility issues, like the water had a breakthrough in the system or the machines didn't pass their test. That's the only way that you would have a delay, but the patient will still get off on their time because there are people that need to get on the machine after them. And if they need an extra treatment, if we have an open chair the next day, they can come in for an extra treatment. Honestly, in my opinion, I think in-center is better for my schedule because it's consistent. I know what patients I'm going to get. I know what their schedules are going to be versus the hospital. You also have to do on call. So say that you work a whole 12-hour shift, you go home, you're on call nurse, you're on call until the next morning. That's 6 a.m. till the next rotation of nurses come. So you can get called in at any point and work over a 12-hour shift that same day. I've known people that worked 24 hours before because they were the full-time charge nurse. Charge nurse is their last leave in the hospital, and they also couldn't go home because third shift, they had third shift, and in the hospital, it's like you don't know what you're gonna get. You don't know if somebody's gonna come into the emergency room and you get more patients. You don't know if you're gonna have an early day or a late day. It's very inconsistent, and I did not like that, and it was hectic. I would not ever go back to the hospital. Depending on the work-life balance that you want, I would probably recommend in-center over being in the hospital just because it's a little bit more crazy and inconsistent. Let's get into some commonly asked questions that I get about being a dialysis nurse. Number one thing, is dialysis nursing boring? I will say it depends on your personality type. I personally don't think dialysis nursing is boring because I talk to my patients and I have a relationship with my patients and we laugh and we have a good time. Now, if you are somebody that needs, like, you need that adrenaline rush, dialysis nursing will be boring for you. Like, if you want to do ED or ICU, like, you want to do compressions and be on your feet and think fast. I mean, dialysis, you do have to think fast for doing that, but if you want to like be pumping, like ED, you are bound to do compressions on somebody. IC, you are bound to do compressions on somebody. Dialysis, it's like rare. We do have our moments where we need to call like a rapid response in the hospital, but we aren't really calling codes like that for real. Not really. Not necessarily. Unless we, because that, I'm about to go on a tangent. I can't go on a tangent about that. But yes, it can be boring. If you are somebody that wants that adrenaline rush, then I would not recommend dialysis for you. I personally don't think it's boring. I like it. I enjoy it. I couldn't see myself doing anything else besides dialysis outside of probably forensic nursing or health informatics. Question 2. Do dialysis nurses just sit there while machines run? No. Now, in the hospital, probably, but in center, no. Because you always have somebody that needs something. You always have somebody that needs to get off the machine, and then you have your new patient coming in. So I feel like you're on your feet more than anything. Third question, is there a lot of blood? Yes, there is blood involved, but you aren't seeing the blood outside the machine. Like the blood is coming from the patient and then going back, getting clean, and then getting back into the machine. So, do you have to be good at IVs? We do not use IVs in center. We use needles, 15 gauge needles, big behind needles for fistulas and grafts. Now that does involve blood. You do have to, the patient does have to hold a lot of pressure, or there will be a lot of blood oozing out. They can literally bleed out and die if it's not like, if like say there was someone that we stuck and they held. We had this happen a couple of times, but nobody died. Thank God. But they held their site and they left the facility and they weren't bleeding anymore. Good dandy. We always tell our patients not to use their arm where the fistula graft is at. Like they aren't supposed to get any IVs on that arm, no blood pressures. That's a part of the education as well that I forgot to mention earlier. Educate them on that, educate them on catheter care and what they're supposed to do, and not to take any showers with the catheters because it's prone to infection. But anyway, we had a patient that went home and his arm would stop bleeding. When he got home, it started bleeding. And he said there was no way to hold pressure. If that happens to your patient, educate them on how to apply proper pressure at home if they start bleeding again, because they can bleed out. If they do not hold pressure, call 911 if it continuously bleeds when they're holding pressure. And they could just not be holding it on the actual puncture hole from the needle. Like the needle will form the hole where the needle was at will form a clot when they're holding. So, is there a lot of blood? And there can be if they aren't holding properly. And the patients that cannot hold their access, we have clamps. In the hospital, you have to hold the site for the patient. It doesn't matter if they're alert and oriented times 4, you have to hold that site for them. No, you do not need to be good at IVs because we do not use IVs. We do use butterfly needles if we need to draw like a stat lab, like if they have a clot or the axis is clotted, we draw a stat potassium. So we do have butterfly needles for that, but actual IVs, no. Can a new graduate become a dialysis nurse? Yes, like I said, you do not need any experience to become a dialysis nurse. They will train you on everything and give you the proper education and guidance. Do I need Med-Surg or ICU experience? No, you don't need any experience to be a dialysis nurse. Is dialysis nursing easier than bedside nursing? I wouldn't say one is harder than the other, but one definitely involves a lot more butt wiping than the other. Hospital, you say hi bye to your patients, and center, you are not allowed to clean up their messes when it comes to urine or pee or poop, like whatever. You do not touch that. They are responsible adults. They walk in that clinic, most of them, and we do not do any cleaning. Is dialysis nursing stressful? It can be if you do not know how to properly manage your time. You have to have great time management skills. And if you do not know how to problem solve and troubleshoot. Is it physically demanding? No. It's not physically demanding. Compared to my rehab job and being on Med-Surg floor, having to transfer patients and all that stuff and not the bed, no. Do you have the same patients every single day? In center, yes. Hospital, it varies. Do I need to understand the dialysis machines before applying? No, you do not. 9 out of 10, you don't even know what machine your facility is going to have if you're in the hospital. If you're in center, most companies have a specific machine that they use for all their centers. Will I lose my nursing skills in dialysis? Yes, because you do not use a lot of like you don't do like a full body head to toe assessment. You do like focus assessments. You do not do IV. So that's something you're worried about. That is why I stay PRN at my hospital job so I don't lose my nursing skills. So that's something you're worried about. I will recommend doing PRN inside of a hospital. Things that I love about dialysis nursing is, or I don't like about dialysis nursing is, even though I'm early bird, I don't like how early we have to get up. On Monday, Wednesday, Friday, the days can be very long. Sometimes the treatments or the patients can be difficult to deal with. Staffing is always low. Nursing wise, staffing is just, it sucks. The emotional side, like the downside, is if you have a patient that you are close with, because you get to go be very close to your patients and they pass away, it is very sad. I had a patient pass away recently. I'm like, oh my god, I can't believe he passed away. But other than that, those are things I don't necessarily dislike, but it's not like a deal breaker for me. Things that I love is also getting to know my patients. It has its ups and downs. Schedule, it's more flexible. I love having specialized knowledge. I love having a routine with predictability. I love the work-life balance, and I feel confident in my specialty. I'm still learning. Every day I learn something new. What came to a shock to me that I would enjoy was getting to know my patients, because I wanted to do liver delivery to bring life into the world, but also I got to know my patients for 2 days and then they were gone. And I didn't get to have any relationship with them. So a surprising factor is that I enjoy getting to have a relationship with my patients, and I laugh every day at my work. Like it's like having a little family, and I love that about dialysis and center. I think you probably would like dialysis nursing if you are the type of person that you want to get to know your patients one on one. If you like a routine and consistency in your schedule, if you want growth in a specialty, I think dialysis is one of the best things to have growth in. There's so much room and so many things to do and so much money to make in dialysis as a specialty. You make a lot of money, and you have the opportunity to make a lot of money as a new grad in dialysis. You pick up what I'm putting down, and you make a difference in a lot of your patients' lives. I will never forget one of my coworkers that I worked with when I was 17. I still see him every once in a while because I still shop at the grocery store I used to work at as a teenager. And I did not know that he was on dialysis until I told him, oh, thinking about making a transition into dialysis. He gave me his experience about being a dialysis patient and just being a light to your patients and making a difference in your life, because your patients come there 3 times out of the week. So a lot of the time, some of them don't have family support, so you're all they have. So if you're somebody that wants to make a difference and a change in somebody's life and have that impact on somebody, I think dialysis would be super good for you. Any type of nursing, you can make an impact on somebody's life, but dialysis, you get to know them a little bit more, see them, spend holidays with them, and all the things. You can do that ICU nursing, but it's a little bit more depressing. I mean, dialysis nursing can be depressing, especially if they're new to dialysis, and just being, the light. So if you're somebody that wants to do those things, I think dialysis nursing will be good for you. If you like the technical aspect of dialysis, like nerdy tech stuff, you will really love dialysis just from the machines as well. Knowing what I know now, would I still choose dialysis? Absolutely, 100%. I'm so glad that I stumbled across dialysis and didn't all those other jobs didn't work out, 'cause I think I wouldn't have been fulfilled in them. I would definitely recommend dialysis to anyone out there. To a new grad, do not feel, you're going to feel overwhelmed, but do not feel fear. Like, in order to overcome, you need to learn and face the fears. Like, don't let the overwhelming feeling stop you from pursuing a specialty that you want. Just keep going and you will find fulfillment. And don't let people tell you need to stick to one field. Like, it's not good to leave and quit multiple jobs. You're young. That's the whole point of nursing, is finding the specialty that you want so you feel fulfilled and you're not a sad, bitter nurse in her career field who puts down new grads or puts down somebody in orientation. Like, I've met too many of those people. Like, you hate your job, find a new specialty. Like, do not be scared to make a change and make that transition. I'm not saying it's good to quit all the time, but you're a nurse, if you're a nurse, you will understand. Your manager will understand. Like, hey, this isn't for me. Maybe I should try a different specialty. Like, that's really all it comes down to. Nursing, there's so much to do within nursing. Why not find it out? That's why we got our license. Not to be miserable. So find what works for you and don't listen to the outside noise. There were so many people that told me, you don't need to do dialysis nursing, like you need to start in the ICU. I'm like, that's not what I want to do. Like, I don't want to be in the ICU. Like, I don't want to do that. Like, if I can make more money, not even about the money, but if I can find fulfillment in something in nursing, why not? Like, I already know I don't want to do that. So why would I be miserable and do it? Just for something, just for a check. Like, it don't make sense. Like, I didn't even know how much money you can make in dialysis before I got into dialysis. Did not know at all. Like, I didn't even get into it for the money. I didn't know. But baby, now that I do know, it's just a cherry on top. I would suggest going in the hospital first versus in center, because you can get experience in the hospital, and then when you go in center you can get a really good pay raise because there's different tiers of levels when you go in. So I am glad that I stumbled across hospital first and then went into college, making way less money in the hospital, way less money than I am now. So I definitely recommend. That's because I came in with experience, even though I didn't know nothing about in center. It didn't matter. It was still hemodialysis. So I would advise that. It is going to be a culture shock going from hospital to in center, for sure. Definitely a culture shock. And I think everybody should be using Epic, because in center you don't use Epic. It should be illegal not to use Epic as a computer system. Like, that should be the only computer system. Point blank period. There should be no other options. Like, I love Epic, hands down. If I were to go work for Epic, I would do that. And you get to travel. But yeah, that is it for today's video. I'm sorry I couldn't go into super detail. If you're considering dialysis nursing, what questions you still have, comment them down below so I can put them in another video. I can also make more videos about acute dialysis nursing, in-center, acute versus in-center, rehab nursing, my different nursing specialties, nursing career experiences. Also comment if you're already a nurse or a nursing student, or if you're thinking about going into nursing, and I will see you guys in the next vlog or nursing video or whatever video you choose to watch.